In some of our discussion on lumbar stabilization and strength building of the multifidus, we have to consider the same thing with chronic discogenic instability over the C4, C5, and C6 motion segments. The deep posterior rotator musculature always atrophies, and over time can be replaced by fibrofatty infiltration. So we need to do a good job at re-strengthening these muscles in positions that are comfortable and for our patients that don't provoke any neck pain. So the first way to begin building strength in the deep posterior extensor muscles is to have your patient come up to one of your treatment tables or a countertop or table at home, to spread their feet out, soften their knees a little bit, and put themselves on their forearms. They lift their chest away from the table, bring their chin down and in to activate the flexors, and now the patient is holding up the weight of their head against gravity. This will cause a light isometric strength building for the superficial, intermediate, and deep extensor musculature in your patient's neck. I like to have the patient hold this position for 30 seconds, then come up, relax, maybe shake their arms out, and repeat that procedure 4 to 6 times in order to build a platform of isometric strength in the posterior portion of their neck. Additionally, if you see a good deal of atrophy, perhaps the patient has had chronic neck pain for many years, perhaps the patient's had a cervical laminectomy, a cervical fusion, and now there's clear visible evidence of atrophy in their neck, they may need slightly more isometric strength building, and this is where the TheraBand comes in. So again, we have the patient come up to the end of a treatment table or end of a countertop, spread their feet out, soften their knees a little bit, and bring the TheraBand right around their ears. And it's important that their thumb and their fists are right close to their temples, okay? At this point, we have the patient carefully come right down onto their elbows. Lift their chest away from the table, tuck their chin down and just pull. This will increase the maximum voluntary contraction of both the superficial, intermediate, and deep extensor musculature, and build back a good degree of muscular-based stability over the top of your patient's C4, C5, and C6 segments.